All right, so take two. I uploaded my last video and didn't change a lot of the settings. This trial and error, and it shut off halfway between. I logged in, but evidently the audio didn't pick up for the second half, which gave me a pretty good excuse to go get some stuff, which I love doing. So this is a second take of the the video adjusting to treatment. And so I know the first half did take, but I think I took it down, but I don't know how that works either. I'm just going to go over that first part again, even though that did take with audio. And I started with, to the best of my recollection, I was remiss. I mentioned some treatment centers that were doing really good things, and there's many more than I'm aware of. But I mentioned Harbor of Grace here in Havre de Grace, treating first responders with trauma, addiction, mental health, and I didn't mention, which I was hesitant, should have, was On-Site. On-Site is a treatment center in Tennessee, which is just beyond good. They are very, very special. They treat trauma, process disorders, addictions, couples, individuals. They do very intensive treatment. I went there well into my recovery from substances, but well into my addiction to other things. And, going there, I kind of had this, I was still living that egotistical, arrogant life of, this will be a little difficult because, I'm professional, you're professionals, how that is. And I shared that at the first meeting, and they said, don't worry, we'll be fine. And they were fine. Because what they do and I do are very, very different things. It's not even the same. It's not even the same field. It's just incredible what they do. So On-Site in Tennessee, I could not give higher regard to what Myles has done there. Is just beyond. It's just amazing. And then the other thing, I mentioned these books, but I have them here in front of me. So the first one, if you have a loved one that does need help, this book by Jeff and Debra Jay, Love First, is just a fantastic book to kind of walk you through how to approach someone, and then really a blueprint for intervention to do yourself or to hire someone. And then I attributed this to Debra Jay, which is actually Jeff Jay and Jerry Boriskin, I believe. And this is At Wit's End. And again, I just recommended this to someone yesterday. And this is when someone you love is diagnosed with addiction, mental health, and kind of or illness, what to do and how to approach. And then Debra Jay's book, which is just, again, amazing, No More Letting Go, which is the spirituality of taking action against alcoholism and drug addiction. I could not recommend these books more, with dealing with someone in addiction, mental health, and how to navigate these waters, because they're very tricky waters, and the normal rational rules do not apply. And it may not be intuitive, may actually be very counterintuitive how to approach this stuff. So these are well-tread paths by very brilliant people. So recommend those highly. So talking about into treatment and kind of this second, third week, the adjustment to treatment and kind of what that may bring to the table for the family. Now the person's been away, and so at home you're kind of adjusting to that, although it's still difficult. And there are some pretty normal, natural fears that can come up for the people at home. The two that kind of, I think, come out the most but don't get talked about a lot are the person at home having this belief or thought that, what if I'm the problem? What if they're talking about this idea that we're the problems at home, and in order to get better, they need to make a new decision about us? And the other fear is, what if my loved one gets better and realize they don't want me anymore? So both of those have this kind of underlying theme of loss, abandonment, and very normal, very natural. The likelihood of these things happening, in my experience, are very rare, but the fear of them happening are very, very common. And so just to, I say that just so you know, if that's coming up for you, it's very, very normal. In treatment, this is where things can really get a little dicey, because now you have someone who's been in treatment for, although it's 2-3 weeks in the real world, in treatment, that's a really long time, because you're talking about someone who's eating, breathing, sleeping treatment. They are getting group therapy, individual therapy, lectures. They're doing a lot of work individually. They're talking with their peers. They're talking with professionals day in, day out. So this is a master's level class of recovery, wellness. They're just thinking about them. They're just looking at their past. They're just looking at these issues. So they are kind of growing and working by these leaps and bounds. And this is where things can get a little tricky, to where the one person thinks, look at how far I've come, and the other person says, what do you mean? You were just here 2 weeks ago, and there are still holes in the wall, right? We still have a court date. Like, what do you mean? So this is where we can start to get a pretty big disconnect. Also, we can start to get some issues with phone calls or visitations, if you're having those, of one party being kind of this newfound freedom, this freedom from bondage, this happiness, this maybe even euphoria, this kind of, I'm going to use the term incorrectly, but just as a measure of explanation, this flight to health, and the family is still in really the midst of the storm, right? If to use the metaphors, the house is on fire, and this person got out and they're in treatment, and this person is still watching the embers, right? And they're still sorting out the wreckage of the past. So these are very different perspectives. And so that can cause a lot of issues. And the person at home has kind of been conditioned to be the one to walk on eggshells and be the caretaker for the identified patient. So then they think, well, I don't want to ruin anything or hurt the recovery process, so let me bite my tongue. And so then that can lead to resentment. And here I go again. I'm still taking care of the person, even though they're in treatment. And when's my turn? And so it can really, a lot of things can kind of come up at the perfectly natural, perfectly normal. And again, I'll say that just because someone else gets help doesn't mean that your issues get any better. It's just not how it works. So at this point, we do need to have this separation where this illness affects everyone. And if I have an illness and it affects my family, me getting better from my illness does not get my family better from my illness. They now have their own work to do. And watching me get better could make my family angry. Resentful, how dare I, right? And so all these issues arise, which leads me to say it's important that everyone gets their help, and we're just not great at that. We're really good at getting the identified patient surrounded, loved on, cared for, peers, education, and we're just not great at this family piece of this other loved one getting the care that they need. And so that's kind of if things are going well. Also, don't be surprised to hear your loved ones say, mention these great insights and these great pieces of information and share with you, and for you to be a bit taken aback because you've said these exact same things for years on end. Don't be surprised. It's just, one is when the student is ready, the teacher will appear. Two is that, if I'm coming to someone to give them advice, there's no emotional charge there, right? I'm a third party. They're coming to me with their guard essentially down, but certainly not as defensive as they would a spouse or a loved one, where all these defenses are up. There's all this history there. There's no history there with me. So I'm just in a better position to do that. The other thing I do want to mention is what if it starts to go a little sideways? What if you're hearing from the loved one, like, this is, I'm ready to go, learn what I need to learn, good enough, need to get out of here. I would recommend that there's no triangulation and everything is done out in the open and everything is transparent. So to that, I would say, okay, great, let's talk with you and the clinical staff, your counselor, the program director, clinical, whoever. Let's get on a conference call, speakerphone, let's get everything. What are we talking about here? Just to get everything on the up and up and make sure there's no kind of manipulation. And this is where I want to really, again, separate the individual from the illness. Because the illness will say, okay, got it, made a decision, not using it again, learn my lesson. And it convinces the person that that's accurate, that they really are done. But it's a lie, right? It's just the beginning of a relapse process. And so having the transparency and the openness and hearing what is really going on, it's questioning the illness, not the individual. And we really need to question the illness. And the individual may get upset and they may be kind of resentful or hurt by that, but I'm willing to do that in order to question this illness at every turn. And so the other thing I want to mention is the reasons for needing to leave treatment. And this is where I'll say that why are we going to treatment, right? What's the goal of treatment? And so the goal of treatment is it's change, right? To me, that means change. That's why we go to treatment. We don't go to treatment for comfort. That's not it. Now, the problem is I'm going to somewhere to get help. I'm going to a healthcare agency. I want to feel better. And if I don't, I get upset and think that this place isn't helping me. Well, feeling better is often what got me here in the first place. And perhaps that's not my goal. Perhaps being better and getting better is my goal, which by definition is uncomfortable. Change is uncomfortable. And so if I'm going for change, there's going to be discomfort. So the idea of hey, I need to get out of here, you don't understand, it's the food or it's the sheets or you have to be able to look beyond that and say, well, you're not there for that, right? You're there to save your life. And I worked with, just the smartest people in the world when I worked at Johns Hopkins, and just this incredible program, the chronic pain program. It was Dr. Michael Clark's program. And there's a gentleman there, Dr. Glenn Treisman, and we were doing rounds one morning on the patients in the pain program. And I mean, these patients were there because their lives were just ruined by really complex chronic pain problems and really, really high use opiates. I mean, really high use opiates. And they would come there, stay there for months at a time, and really get their lives back. It was an amazing program. And we were doing rounds one time, and this patient who had really made a lot of progress and done very well. And rounds, you know, you have the psychiatrist there, the nurse there, the resident there, the social worker there. I mean, you have the whole team there just to talk about whatever your needs are. And the patient talked about how bad the food was, and Dr. Treisman, who just has a wonderful way about him, says, "You came to Johns Hopkins Hospital for the food? You came here for the food? Oh my Lord, that was a bad idea. We don't have good food." He said, "We have probably the best healthcare there is and the smartest doctors there is, but don't come here for the food. If you want to know a place to get good food, I'll tell you. But man, don't come here for the food." And I'll never forget that, because it's just a perfect illustration of how lost we can get when we become uncomfortable. Most people go to treatment to save their lives. And if I'm trying to save my life and I'm complaining about the thread count or the food, and I don't want to minimize, people's experiences, but chances are my illness is trying to talk me out of where I need to be. And so it's important to question that, and it's important to remind and just be there and say, look, striving for comfort may be kind of what gets us to these places. And change is uncomfortable. And I don't mean no one should endure abuse or mistreatment. And that's why I say get everyone on board and on the phone and find out really what's going on and make sure it's reasonable. Because the other thing is, magic is not 28, right? There's no magic in that. So it's not one size fits all. So and to say 28 days is what someone needs for you've ever met them is also a bit absurd. So I'm not saying it has to be that, but find out what the reasons are and the rationale and what the plan is afterwards. That's very important as well. It's important to remember what the goals are. Sometimes while the person is making it towards the goals, don't be surprised if that still brings up hurt, fear in you as a loved one, to see them getting towards the very goal they went there for. Like I said, every part of this process is difficult. And it's important to focus on self-care, get the help you need while they're getting the help they need. And make that a priority. They're a priority, you're a priority, everyone is a priority. That's the best way to make it. The family healing together is the one that gets better, right? Rather than just the individual part and then expecting that to come back and making everyone better. So hopefully that helps. Thanks.